Our post-rehab tip for this month looks at the Thomas test. And we have Jan here seated, but we're going to start with her standing. Let me ask you to stand, Jan. And what we're going to ask our client to do is actually put the ischial tuberosities right on the very edge of the table. Now, the ischial tuberosities are the things that you actually sit on, those little bones that you sit on. We're going to ask her to sit right, put the ischial tubes right there on the very edge of the table. Then we're going to ask her to bring one knee to her chest, using her hands behind to support it, and then the operator, or myself, is going to support the client as she goes back into the supine position. Now, we're going to ask her to hold that knee there in the chest, and what we're looking for here are two things. We're looking for the angle here at the hip, and we're also looking at the angle here at the knee. Now, when we look at the hip, we're looking at the hip flexors. If her leg is anything greater than parallel, now actually she looks pretty good here, but if her leg were actually sitting up a little bit higher, it would tell us that her hip flexors, or psoas, is tight. But you can see here her femur looks like it's pretty parallel to the floor, so we're actually looking at hip flexors being pretty loose. But we also look at her knee here, and what we should see is that the angle here at the knee is 90 degrees. What we're finding here with Jan is we actually have her knee is almost straight here, so she's in a bit of extension. So our problem here is the rectus is actually tight. Her rectus runs from here, the ASIS, down to the patella. Actually, it inserts into the patella tendon and also into the quadricep tendon. So what we're finding here is her rectus is tight, and that's actually causing her knee to move into a bit of extension. What we should see, as I said before, is that this knee, the angle here is at 90 degrees. So from our test, we're able to look at two things on a side view. Number one, we're able to get an idea of hip flexor tightness. We're also able to get an idea of rectus femoris tightness, which is also a hip flexor and a knee extender. If that hip flexor is tight, we're going to find the client is in this position. Our psoas, that means if our psoas is tight. If the knee is extended, that means that the rectus femoris is tight. Now, we're also going to look at this from a front-on view and get an idea of what's going on with her IT band. Now, we have a straight-on view of the Thomas test here. One of the things that we're going to do with the Thomas test, we mentioned two things already. We looked at the psoas and we looked at the rectus, but we also can look at the tightness in the IT band. What we should see is, once we get our client into this position, is that the femur should be in a nice normal alignment with the hips and with the rest of the body. When we see the femur being pulled into abduction, it's telling us that this IT band is very tight. You can actually even see the outline of her IT band here. Okay. You can also see that she's being pulled slightly into a little bit of abduction. So what we should see is she should be right about here, but she's being pulled out to the side a little bit, and we can actually see that IT band is tight. Now, we already noted that her rectus is tight, but we also can see that there's some IT band tightness. So this Thomas test actually does three things for us. It allows us to look at three areas. We can look at the IT band, we can look at the psoas, and you also can look at the rectus femoris. One of the key things with this Thomas test is to make sure that we put the ischial tubes at the very edge of the table. One of the common errors we see in some of the textbooks is that they'll set this test up and we'll see the hips are actually much farther back on the table, and they actually should be at the very, very edge of the table. So those ischial tubes, those things that you sit right down on, should be at the very edge of this table. Again, the Thomas test. This is a great test for runners, for clients with low back pain, any type of knee pain, or just simply tight hip flexors. One thing to caution you about, though, here with the Thomas test, if you have clients that have acute back pain, that means they're having back pain right then and there, or radiating pain, do not use this on them. For those clients that have acute back pain or radiating pain, they're just not going to be able to tolerate this position.